Trends, Den Trends.
Hello, everyone, and welcome back to another episode of the DenTalk podcast. I'm delighted to have you with us as we continue exploring the science, technology, and clinical principles that are shaping the future of modern dentistry. Today's episode is designed especially for dental students, general practitioners, young implantologists, and every clinician who wants to strengthen their understanding of implant dentistry. We're talking about dental implant foundations every dentist must know. Before placing an implant, selecting a prosthetic component, or planning a digital workflow, every clinician must first understand the biological principles and clinical foundations that determine long-term implant success. Implant dentistry is not simply about replacing missing teeth. It's about restoring function, preserving bone, improving quality of life, and delivering treatment that remains successful for many years. So, let's begin with the basics. A dental implant is essentially an artificial tooth root that is surgically placed into the jawbone to support a prosthetic restoration. In most modern systems, the implant is designed as a threaded titanium fixture that becomes integrated with the surrounding bone. Once healing is complete, an abutment connects the implant to the final crown, bridge, or full arch restoration. Although this sounds straightforward, every implant restoration is built upon several precisely engineered components. The implant fixture is the portion placed inside the jawbone and serves as the foundation of the entire restoration. Immediately after placement, a cover screw is often used to seal the implant during the initial healing phase. Following osseointegration, the cover screw is replaced with a healing abutment that helps shape the surrounding soft tissue and prepares the site for the final restoration. From there, impression copings, transfer copings, implant analogs, and prosthetic components allow the dental laboratory to accurately reproduce the implant position and fabricate a precise restoration. Every component has a specific purpose, and understanding how they work together is essential for long-term prosthetic success. Now let's talk about what truly makes dental implants possible: osseointegration. Osseointegration is the direct structural and functional connection between living bone and the implant surface. It is the biological foundation of implant dentistry. Without successful osseointegration, an implant simply cannot function over the long term. Following implant placement, the surrounding bone begins a remarkable healing process. New bone cells gradually form around the implant surface, creating a stable biological bond. This process transforms the implant from a foreign object into a functional part of the jaw. Every successful implant case depends on respecting this natural healing process. Dental implants can also be classified in several different ways. Based on their anchorage, implants may be categorized as endosteal, subperiosteal, transosseous, or blade-form implants. Today, the endosteal implant remains the most widely used system because of its excellent long-term clinical performance. Implants may also be classified according to their shape. Modern screw-type implants dominate contemporary practice because they provide superior primary stability and predictable outcomes. Surface technology has also evolved considerably. Commercially pure titanium remains the gold standard due to its outstanding biocompatibility and ability to support osseointegration. Many implants feature specialized surface treatments such as acid etching, porous coatings, or hydroxyapatite modifications that encourage faster bone attachment and improved healing. One important concept every clinician should remember is that implants are not natural teeth. Natural teeth are suspended within the jaw by the periodontal ligament. This ligament provides proprioception, shock absorption, and slight physiological movement during function. Dental implants have no periodontal ligament. They are directly anchored to bone. Because of this difference, implants respond differently to biting forces and cannot adapt in the same way as natural teeth. This is one reason why excessive occlusal loading, parafunctional habits such as bruxism, and poor prosthetic design can increase the risk of implant complications. It's also why implants are generally avoided in growing patients, as they do not erupt or adapt with continued jaw development. So, when should dental implants be considered? The most common indication is replacing one or more missing teeth. However, their benefits extend much further. Implants improve chewing efficiency, restore speech, maintain occlusal stability, preserve alveolar bone following tooth loss, and significantly enhance patient comfort and confidence. They also serve as valuable anchorage devices in modern orthodontics and complex multidisciplinary treatment planning. When properly maintained, implants can provide decades of successful function. Clinical studies consistently demonstrate long-term survival rates exceeding 90% over 15 years, with many implants lasting much longer under appropriate maintenance. However, implant success is never guaranteed. Several risk factors can compromise treatment outcomes. Uncontrolled systemic diseases such as diabetes, smoking, alcohol abuse, active periodontal disease, poor oral hygiene, inadequate bone quality, and uncontrolled bruxism all increase the likelihood of complications. Perhaps the most important step in implant dentistry is careful patient selection. Choosing the right patient is often more important than choosing the right implant. Successful implant treatment always begins with comprehensive planning. This includes understanding the patient's medical history, evaluating systemic and local risk factors, discussing expectations, and performing a complete clinical examination. Radiographic assessment using panoramic imaging and cone beam CT provides valuable information about bone anatomy and vital structures. Clinical photography, periodontal charting, study models, and occlusal analysis all contribute to a complete treatment plan. Equally important is patient communication. Clear discussions about treatment options, costs, maintenance requirements, risks, and expected outcomes help build trust and establish realistic expectations before treatment begins. Modern implant planning also benefits from advanced digital technology. Diagnostic wax-ups allow clinicians to visualize the final restoration before surgery. CBCT-guided planning software enables accurate three-dimensional implant positioning. Radiographic guides and surgical stents improve precision during implant placement while reducing the risk of complications. Together, these technologies help clinicians achieve prosthetically driven implant placement rather than simply placing implants where bone happens to exist. Once healing is complete, attention turns to the prosthetic phase. An accurate impression is essential for creating a restoration that fits precisely. There are two commonly used techniques. The open tray or direct technique offers superior accuracy, particularly when restoring multiple implants or implants placed at different angles. The closed tray or indirect technique is often preferred for simpler cases involving parallel implants. Regardless of the method used, the objective remains the same, accurately transferring the implant position from the patient's mouth to the dental laboratory. A small error during impression making can lead to significant complications in the final restoration. As we conclude today's episode, let's remember the key message. Successful implant dentistry is built on strong foundations. Understanding implant biology, mastering component selection, respecting osseointegration, performing thorough treatment planning, and executing every clinical step with precision are what separate predictable long-term success from avoidable complications. Technology continues to evolve, but the biological principles of implant dentistry remain unchanged. When those fundamentals are respected, dental implants continue to provide one of the most reliable and life-changing treatments available in modern dentistry. Thank you for joining us for another episode of the DenTrends DenTalk podcast. At DenTrends, our mission is to educate, inspire, and connect the global dental community through evidence-based education, emerging technologies, expert insights, and the latest trends in clinical dentistry. Visit dentrends.com for more podcasts, clinical articles, conference coverage, technology updates, product reviews, and educational resources created for dentists, students, researchers, and industry professionals around the world. Until next time, stay informed, stay inspired, stay ahead with DenTrends.